How is stomach lymphoma diagnosed and treated? When it comes to stomach lymphoma, understanding how it is diagnosed and treated is crucial. Stomach lymphoma is a type of cancer that starts in the lymphatic tissue of the stomach. The diagnosis process typically begins with an upper endoscopy, also known as a gastroscopy. During this procedure, a doctor uses a thin, flexible tube with a camera to look inside the stomach. They can also take small tissue samples, called biopsies, to examine under a microscope. This helps confirm whether lymphoma is present and identifies its specific type. In addition to endoscopy, blood tests are performed to check overall health. These tests can reveal important information, such as blood cell counts and levels of lactate dehydrogenase, which may be higher in lymphoma cases. For certain types of stomach lymphoma, especially gastric mucosa-associated lymphoid tissue lymphoma, tests for Helicobacter pylori infection are also done. This can involve breath or stool tests. Imaging studies play a key role in the diagnosis as well. Computed tomography scans and positron emission tomography scans, combined with computed tomography scans, help determine how far the lymphoma has spread. These imaging tests can show enlarged lymph nodes and any involvement of other organs, which is important for staging the lymphoma. Sometimes, additional tests may be necessary. For instance, fluid samples from the chest or abdomen may be taken to check for lymphoma spread, but this is less common unless there are specific symptoms indicating a need. Once diagnosed, treatment options vary based on the lymphoma subtype, stage, and individual health factors. For gastric mucosa-associated lymphoid tissue lymphoma linked to Helicobacter pylori, antibiotic therapy to eradicate the bacteria can lead to remission, especially in early stages. For more aggressive lymphomas or advanced stages, systemic chemotherapy is often used. This type of treatment targets lymphoma cells throughout the body. Radiation therapy may also be part of the treatment plan, either alone or in combination with chemotherapy, particularly for localized disease. Targeted therapies, such as monoclonal antibodies like rituximab, are commonly included in treatment regimens for certain types of B-cell lymphomas. Surgery is rarely the first line of treatment but may be necessary to address complications like bleeding or obstruction. The choice of treatment is tailored to the specific type of lymphoma, its stage, and the patient's overall health. Multidisciplinary care involving oncologists, gastroenterologists, and pathologists is essential to ensure the best outcomes. It is important for anyone facing this diagnosis to consult healthcare professionals for personalized advice and treatment options.